Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning in to my latest video. Apologies I haven't uploaded in the last few days. Just had a lot going on at work and some exciting new developments which I will update everyone in due course. We have a client here who attended with bilateral impacted dead skin, so keratin and earwax. We started off with the patient's right ear. The patient felt this ear was the worst one out of the two, and they had been using some, I think it was hydrogen peroxide drops. So the dead keratin and wax in the right ear is a bit more moist and wet. You will see if you watch the left ear, a bit later on, it was a lot drier, and I used the forceps primarily to remove the dead skin and wax. If you enjoy, I know a lot of viewers really enjoy the forceps, so do stay tuned. Couldn't really use the forceps in the right ear because the wax is, as I said, a bit softer, and the forceps will just, because it's wet and soft and mushy, it will just dissect into little pieces. It won't remove large chunks. So you can see we've removed the blockage. Just hovering over the canal wall, that's the anterior canal wall, and again this is quite lateral. The patient has got a bit of otitis externa, a bit of eczema of the ear. So otitis externa is an umbrella term given for an infection or inflammation of the outer ear canal. It can encompass several pathologies, but one of them can be what we call superficial otitis externa, and that's just like an eczema of the ear, local eczema. So I'm just trying to take some of this dry skin out. I've advised the patient to avoid water in the ear, so water can exacerbate otitis externa, and water's bad news anyway, even if you don't have problems in your ears. To keep it that way, you want to really avoid water entering, and I've advised the patient to use some EarCalm, which is an acetic acid spray, which will help with the otitis externa. So just using the zonal suction probe at the entrance. Actually, this is not even in the ear canal, but just outside the ear canal here, just behind the tragus. So we all have this little flap of cartilage on the outside part of the ear. This is just behind the tragus. And there's some wax, dead skin, just to the left of the ear canal as we enter. It's a bit of a blind spot there, and you can see we're just using the zonal suction probe to remove some of this dead skin. Typically with an otoscope. So an otoscope is an ear torch that is generally used by most ear professionals to examine the ear. So I got trained using an otoscope. I probably wouldn't see that, but with an endoscope, because of the wide panoramic field of view it provides, it really does allow us access to all parts of the ear canal. So again, one of the landmarks of the outer ear canal is the cilia, the hair. So again, we know there's a bit more dry skin. This is just into the ear canal itself, and we call this the concha cartilage. So the outer bowl of your external ear, so what I call the satellite dish, that bowl you have there, that's called the concha, and more specifically that region near the ear canal is called the cavum concha. So this cartilage then extends into the ear canal, and we call it the concha cartilage. And just using the Jobson horn, it allows me to apply some pressure. Because we're on the outer third of the ear canal, we have a thick layer of skin, a millimetre in thickness approximately, some muscle and cartilage, and we can apply some pressure. Can't apply too much because obviously we don't want to cause any pain or discomfort, but with the concha cartilage we can apply a bit of pressure because it's semi-sensitive and flexible. We couldn't use the Jobson horn like we did in the right ear, deeper in the ear canal against the bony part. That would be very sensitive. So this is the left ear. You can see the wax, the dry skin is a lot drier. I've just gone in with an ear hook to begin with, and I'm just trying to detach the skin adhesions from the roof of the ear canal and from the front of the ear canal. You can see it's really, really dry. The patient hadn't been using drops in this ear. Quite often when you have patients who attend with earwax in both ears and they've been using drops, they're very reluctant to put the drops in both ears because whilst you're using the drops, it can cause more of a blockage, and that's because the wax or dry skin absorbs the drops and expands and swells. So So the patient was more or less completely deafened in the first day of the writing of the drops, and for that reason they didn't want that effect to happen in the left ear, which is the ear we're in now. With our technique, the endoscopic microsuction, the dry technique, very seldom do you have to prepare the ear prior to attending. Well, I can only speak for myself, but I know it changes for everyone. Different specialists have different ways of booking in their clients and different recommendations. For myself, I always advise patients, if they're calling and they want an appointment on the day, that there's no prerequisite to use drops. Even if the wax is really, really hard and solid, I should be more often than not able to remove it. And quite often I use drops during the procedure myself if need be. If you're having ear irrigation performed, previously known as ear syringing, you do need to soften the earwax using some drops, typically between 5 and 14 days, and again that varies, the advice varies between different practitioners, different surgeries in the UK. So you can see this long tail of dead skin hanging out the ear. Just gone back in with the forceps. With the forceps we have to be very gentle and careful. The tip of the forceps is quite sharp, so we don't want to stab into the ear canal wall, and that's why very seldom do we use forceps to remove a thin layer of skin or wax that's just lining the eardrum, because if it's just lining it, there's nothing to grab onto. The tip of the forceps will make contact with the eardrum. We don't want to pierce that and puncture and perforate the eardrum. So similarly to the right ear, I'm just using Jobson horn just to apply. So again, we can apply this level of pressure on the outer third of the ear canal, but if this was on the bony part of the ear canal, we wouldn't be able to apply this amount of pressure. It would be too uncomfortable for the patient. Just to advise anyone, if you are in the UK and you need an earwax removal, you've got a blocked ear, please do visit our website, www.clearwax.co.uk. The URL, the web link is top right screen. And from our website you can find your local earwax removal specialist. Not all specialists on the website are trained by Clearwax. So we have a national database, and any of the specialists who subscribe to our website have to declare that they have been trained by an accredited earwax removal course, and they've got all the relevant insurance in place. So we always encourage, and they can't create a profile and list themselves without declaring that. We do ask all the patients to, if you've got any questions, to contact the specialist directly. And on the website you can type in your postcode, your city, town to find your nearest specialist, and you can view the specialist profile. You can read about them themselves. They write their own biography. You can see which treatments they offer. Not everyone offers microsuction, or they do, but they also offer irrigation. I hope you enjoyed that video, guys. That's all the wax on a tissue. You can see that a lot of dead skin as well there, and the wax that we did remove was very dark, so it's oxidized. It's been there for a while. I weighed all the contents of both ears, and it weighed in just over half a gram, 573 milligrams. Wishing you all a great weekend, guys, and I hope you're keeping well and safe wherever you are in the world, and I shall hopefully upload some new videos in the next couple of days. Thank you, bye.